Hey everyone, it's Dr. Rick, and excuse my voice, I'm resolving an infection. Should be better within 3 days. I already started my herbal protocol, and if you don't know what that is, please consider subscribing to my YouTube channel as I put out natural remedies that doctors recommend. So if you haven't seen my videos before, I did do a previous unboxing on 2 different mouth tapes. If you're not sure what mouth tape is, it's essentially keeping your lips somewhat pursed at night. Now, not like that, but just together at night. As you get older, there's a tendency for the masseters to drop down and the jaw to open, especially if you're in the lying on your back position. That's called supine position. And it's okay, there's nothing wrong with it. But if you think about pressure when you have flow, say you have 2 tubes equal size and you say put a vacuum right here between the 2 entrances of the tubes, well, they're going to pull equally if the vacuum is the same power and the tube is the same diameter. Now if you have a big tube here and here's the opening, and a tiny tube here and that's the opening, and the vacuum's here, well, when the vacuum gets turned on, it's going to preferentially suck from the bigger tube. It might get some from the smaller tube, but it's going to be a lot of resistance and all the force will be coming this way. Same thing with your nose and your mouth. The nose is made to baffle the air coming through the nose so that it hits the turbinates. Those are little shelves. It hits 3 different turbinates and then it hits the hairs that are on the turbinates. And then the turbinates themselves have a passageway. If you turn to the side, it goes up and then down. So air has to constantly go through this turbulent movement. And what happens when you push things around and add movement to things? They heat up. So when they heat up, when this air turbulence goes through filters, hits a little hair, then bounces off, hits another hair, and the hair has a little bit of mucus or it's positively, negatively charged, it'll take all the, by static and by stickiness of the mucus that you produce. It'll take all the bad stuff out of the air and give you pure air. Now, there's always going to be, if there's way too many pollutants and you live in, say, a crowded industrial developing country like Manila or I think Bombay, there are places where you just have a ton of diesel fuel and it's very congested. And if you take a cubic foot of air there, sample it downtown, and then you go to the country, you're going to have more pollutants in the cubic foot of air from the city. So it always depends on where you live. Also, if you live in a pristine place, but you have 3 dogs that shed, you watch that dog that goes like this and shakes, you'll see all the hairs come up. And even though you might not see that in the afternoon because you don't see rays of light coming through, it's still in the atmosphere and you still have to filter it because your lungs are very delicate. The lining of your lungs is supposed to just transmit and exchange oxygen and carbon dioxide, and that's it. And it doesn't want to have to deal with soot or solid particles, viruses, bacteria, so even fungi from soil. So you have to be careful, and that's why we have the nose as it is. Anyway, I'm getting down a long-winded road. All that stuff there makes it harder and more resistance versus the big mouth. Air gets pulled in. It's like a huge tube. Well, if you're sleeping and your lungs are, the diaphragm's going down, negative pressure pulls like a vacuum, it's going to pull from the larger tube because it's a larger diameter. Well, if you have big tonsils, if you have a big tongue, if you just have a propensity to have obstructive sleep apnea in the family, and you don't have to have that diagnosed, you can just have your parent snore like the Dickens, and then the neighbors next door or the roommates can always say, I don't want to sleep next to that guy. Well, that could be potentially mild, moderate, or severe obstructive sleep apnea, and that's not good because every time you snore and you hear and you hear that person stop breathing, that means the heart, the brain is going through a time period where there's no oxygen. With no oxygen, fight or flight. Even though you're asleep, your brain and your heart still going through fight or flight. So that's why obstructive sleep apnea, OSA, sufferers usually have other diseases, obesity because they're very hungry because they're tired, or high blood pressure or heart disease. Regardless, here's a cheap fix. So I've done 2 videos. I don't have the sample of what's called hostage tape, but I'll put a link down below. But here's 2 other samples. This is Somnifix, and this is just mouth tape. That's an inventive name. I don't think I've done a video on this one, but I'll show you the mouth tape one. I'll put a link to the previous one that I did on hostage tape. That's really cool. It's huge. It looks like you're a hostage because it's black. But the bottom line with all these things I'll give you in a second. This is the tape from mouth tape. You just go like this. You put it on the top, close mouth, and put it on the bottom. And that's pretty much it. Now, I can break through that if you put enough pressure, you can break through. I didn't really like these. I liked the Somnifix. I think it was a wider patch. For my guys that have facial hair, might be difficult. Then that's where the hostage tape might come in handy. But here's the unboxing today. Getting down to it now. NextCare. I found this at Woodman's, and NextCare, I have an open one here. It's just it's a adhesive, but it also doesn't stick as much. But there is stickiness to this tape. So this is what I usually do. This is so much cheaper. This is like $6. These guys are like 25 to 50 cents each. So they're cool, and the hostage tape is like 50 cents each. I saw it at $1. They're cool, but that's a lot of money. $30. I'd rather spend it on like 2 steaks or a lot of veggies or a vitamin bottle. Ooh. So all I did was cut this off of this roll. It's sticky over here. I'll close my mouth, and then not necessarily like that, but I'll close it a little bit more, meaning I'll invert my lips. So I can break through that too. and sometimes I'll wake up in the morning, it's like, where's my mouth tape? Where's my mouth tape? And it'll be like that. My grandson gets a kick of that. But the idea is, if you have a little bit of pressure that's keeping this lightly together, I broke through. You saw me break through. And I bet you it would have come up anyway, especially if you have facial hair. If you just put a little bit of tension to close, that's all it needs. It's positive feedback. It's almost like dynamic taping that you've seen on professional athletes. That does nothing to change the mechanics of full force throwing. It just gives you feedback so that you can remember how to throw. It's almost like a physical therapist pointing to the back and pointing to your chest and saying, sit up straight. Well, you can't have a physical therapist do that, but if you put tape in the right area, gentle tape can give you a constant reminder, like having a tape/invisible physical therapist. Well, this is your invisible teacher, physical therapist. You ever have a teacher say, shut up, be quiet, don't talk? Well, think of it that way. If you get this on your lips at night, and the data is okay. The data for mild to moderate obstructive sleep apnea says taping might help. Unless you want to go through more detailed sleep studies, home sleep unit to study, or a study in the office or a hospital. That's a pain in the ass. And they do check you, expansion of your chest, and the pulse ox correlates with your pulse and your breathing. And if they see a drop on the home sleep unit, which is really comfortable because you take it at home, then you can either get approved for a mask, a sleep apnea mask, or a dental device if you have a good dentist, or they'll allow you to go into a facility that tests you overnight and films you. But the ones that they do in the overnight places, they're intricate. They look at your limb movement, they look at your pulse, they look at your EEG, that's an electroencephalogram, limited receptors that they check. But they'll do that, EKG testing, and then a couple of other things to get everything, even putting a camera on top of your face to watch your rapid eye movement, depending on the stage of sleep you're in. So you don't have to go through all that stuff. Sometimes if it's just mild, or you just want to not wake up with a sore throat because you've been pulling air through your mouth, which is dry, especially in winter time, you can try this. $6 at Woodman's, put it on your mouth and see how it goes. If it comes off in the morning, okay, get a bigger piece. Or you can try going up and down. That's an option too. I learned this from one of my patients when I took one of my hikers, Joe, to 14,000 feet. I told him I use fancy tape, and he just says he uses Scotch tape. And I'm wondering, Scotch tape, really? How? You can save so much money. So I investigated, and I like this product. It's not Scotch, it's 3M. So give it a try. I think it might be worth it. Now, this is not to be taken as medical advice, and we have not established a relationship, doctor-patient relationship. But if you're one of my patients that is actively in my membership plan now, then try it out. If you're not one of my patients, then you should have stopped listening, and you're not allowed to do what I just suggested. And you want to be a patient? I'll put the link down below. Otherwise, good to give you some advice. If you have any questions, put them in the discussion points down below on YouTube. Otherwise, subscribe and get other fancy, cool videos from